public lecture part, I want to take you down to the history line which we are very proud of. India is one of those countries which has a surgical legacy dating back to 600 BC. It's unique. And we plastic surgeons are extremely proud about this surgical heritage. The history of plastic surgery in India dates back to nearly 4,000 years. It is believed that Atharva Veda, treatise by Brahma, is the root of Ayurveda. Brahma imparted it to Daksha Prajapati. Daksha Prajapati taught Ashwini Kumar. Lord Indra learned it from them and imparted this knowledge to rishis like Bharadwaja and Lord Dhanvantari. Charaka Samhita and Sushruta Samhita are the two treatises of Ayurveda. Sushruta wrote this treatise approximately 600 BC based on the lectures of his teacher, the surgeon king Devadas, the incarnation of Dhanvantari, the divine physician. Sushruta Samhita is an amazing and immense text. Contains 184 chapters, description of 1,120 illnesses, 300 surgical procedures, classification of human surgery in 8 categories, over 120 surgical instruments, and around 700 drugs from different sources like animal, plants, and mineral. Sushruta was one of the earliest exponent of surgery and embodied art and science. Sushruta's principle and teaching took surgery in ancient India to a noteworthy pedestal, making it the golden age of surgery in the world. Sushruta has been rightly called the father of plastic surgery. He had developed the concept of planning in reverse. He used to map out the defect first, put the map and pattern of the defect in the recipient site from the skin is taken, and he used to plan like this. And his legacy continued. In 4th century, another scholar named Bhagavat wrote Ashtanga Sanghata and Ashtanga Ridanas. He described nose reconstruction, credited the procedure to Maharshi Attareya. He emphasized the need for the inner skin while constructing nose. Sushruta originally had described nose reconstruction from the cheek skin. Attareya also propounded it later. Such intricate surgical details. With sands of time, cheek-nose reconstruction described by Sushruta and Bhagavata got modified. And forehead skin came into vogue. How this forehead skin modification of the original nasal reconstruction technique, it cannot be traced to any personality. But it underscores this point that at that time there was a lot of churning of surgical knowledge which led to fine-tuning and standardization of procedure. And this use of forehead skin for nasal reconstruction is rightfully called the Indian method of nose reconstruction, is recognized world over. And this was practiced for centuries in our country. But unfortunately, this golden era of surgery began a gradual decline. With the sands of time, scriptures like Mahabharata, Jataka, and Manusmriti enjoined strict prohibition on surgical techniques because the touching of blood and pus was considered polluting. And this surgical skill was relegated to professionals like Kumars or potters who are known for their manual dexterity. They kept this wonderful science alive for centuries, and the Indian surgical legacy rested on them, and they passed into from father to son in family legacy and family secrets. Some of these families were later identified during the British time. James Findlay and Thomas Crusoe, surgeons in the British residency in Pune, witnessed the operation of a patient named Kwasji with cut nose. And they reported into Madras Gazette. It was later published in the Gentleman magazine in London in 1794 as a letter to the editor. This proved to be the watershed moment in the history of plastic surgery. The letter appeared in the heading Curious Chirurgical Operation, gave a brief account of the nasal reconstructive surgery, and the letter introduced the Indian method of nose reconstruction using forehead flap to Europe, and which quickly caught on in the West. These methods soon found their way in Britain, and the first nose job by Indian method was done in 22nd October in 1814 by Joseph Capew. This came to be known as the Hindu method at that time, and method described by the great sage Shushruta traveled to Europe through Indian and Arab traders and Buddhists. Even during the 8th century, texts were translated to Arabic, and that treatise was called Kitab Shashul Hind, and it was presented to the Caliph Harun al-Rashid in Baghdad. There was also historical reference that court of King Yashovarman of Cambodia also had a copy of Sushruta Samhita in his language. Later, in a source book of plastic surgery authored by Frank McDowell, aptly describes Sushruta in recent time. Through all Shushruta's flowery language, incantations and irrelevance, there shines the unmistakable picture of a great surgeon. Undoubted by his failures, unimpressed by his successes, he sought truth unceasingly and passed it on those who followed. He attacked disease and deformity definitively with resourced and logical methods. When path did not exist, he made one. At the end, I'll just recite lines which I have penned on this day, for this day. We are the hope for many when options are hardly any. We move to salvage, and it's war we wage when the complex defects and difficult cases. We bring smile to families when the child is born with fallacies. We make the ordinary face pretty and give the right curves to the body. We are savior to the devastated, be it burns, trauma, or amputated. Proud to be of Sushruta's lineage. In India, plastic surgery was there for ages. Thank you very much, ladies and gentlemen.